kadib markii baraha bulshada lagu daabacay warar sheegay in mashiimaha keliyaha lagu nadiifiyo Sbatalka weyn ee Wajeer ay shaqaynaynin ayaa waxaan booqan Sbatalka weyn ee Wajeer si aan u kurgalno xaqiiqda dhabta ee ka jirta goobtaasi. Waxaan kula kulnay goobta keliyaha lagu dhaqo bukaanada keliyaha looga nadiifiyo halkaasi, waxayna noo sheegeen in mashiimaha ay shaqeeyaan adeegyadanina maalinkii habeenkii markii ay u baahdaan loogu adeego, halka ay dhaqaatiirta dadaal badan u sameeyaan.
Axmed Abdullaahi qaybtan renalka general aan joogaa oo lagu dhaqa marka waxaan ka hadlaynaa maanta mashiimaha afar ataashi afarta wada way hagaagsiin alxamdulillah si fiican u shaqeynayeen. qaybta daawadana waa iska fiican tahay oo mashiimaha maartay qaybtan lagu isticmaalo iyo daawada lagu isku daro dhiigga waxaan kulli alxamdulillah waa iska fiican tahay. maartay wala hagaajin mashiimaha diyaar waa afarta mashiin way shaqeynayeen alxamdulillah. hadda daawada wax kasta waa diyaar, hadda wax nusqaan ma laha. maya maalinta way shaqeysaa, dadka emergency jiraan habeen waa la imaadaa. hadda maanta hadda dhakhtarku noo imaaday qof baa la durayaa, dadkaas uga hada anaga shiftayna way badan tahay. hadda afraan laqa hadhowna afraan laqa kasi dambadana casar maartay dadkaas 10 saac ka baxayeen, dad habeen ay ku galaa jira maartay ka wala laqa caadi wax oo maartay habeen dhaar ba dhakhtarintu way shaqeeyaan.
Farah Maxamed Allah Farah dhakhtarinta saacada daacad bayna wax noogu dhaqan waxa tabartooda dhakhtarinta nabashin bawaan moowi.
madaxa fulinta howlaha Sbatalka weyn ee Wajeer Dr. Daahir Somo oo ka warbixiyay sida ay u shaqeyso goobtani ayaa sheegay in ka badan 28 bukaan ee halkani keliyaha looga nadiifiyo.
Currently in the dialysis unit we have 5 functional dialysis machines which are working, and we have 28 patients who are utilizing those services, and we normally work from Monday up to Saturday. Sunday is the off day because the number of patients is a bit on the higher side. So we normally do 3 shifts, 4-hour shifts, 3 of them per day. We start our work from 6 a.m. up to 7 p.m. every day apart from Sundays. So we have 4 machines for the normal patients and 1 for the isolation patients. These are the highly infective patients. We have 1 machine for them. The biggest challenge we have is for the critically ill patients who require intensive care unit. As you know, Wajeer County Referral Hospital does not have the ICU services, so those patients we refer. Referral is also part of good patient management.
Dr. Daahir ayaa sheegay markii la furo xarunta xaaladaha degdega iyo shilalka ee haatan dhismaheeda uu socdo laga maarmi doono adeegyada caafimaad ee loo raasan jiray caasimadda dalka.
But there are also plans to operationalize the accident and emergency department within 4 months. This is one of the flagship projects of His Excellency the Governor, and this accident and emergency department will have 12-bed ICU, 12-bed HDUs. It will have 3 operating theaters. We will have 44-bed capacity wards. We will have 4 private rooms. It will have a laboratory, a pharmacy. It will have an OPD side. It will also have an accident emergency side. It will also have its own oxygen plant. It will have a desalination plant. As you know, the water in Wajeer is a bit hard, so it normally corrodes the equipment we have to replace every time. So it will have a CSSD, which is a central sterile service department, which will be able to sterilize all the equipment that we need. The other thing that will also be there, it will also have solar. In terms, it will be solarized so that when there is no power, we have 2 options: the solar system, or we also use the backup generator, which is about 550 kVA, which can also handle the whole hospital actually. Yes, so for now the ICU services we are referring, but there are plans to operationalize that within 4 months. Yeah. And also the new accident emergency department will also have a new dental department. As you know, this is our old hospital. A lot of infrastructure development was not done previously, so we'll also have a new dental unit.
Ugu dambeyntina waxa uu sheegay in dhaqaatiir ku soo takhasuseen xanuunada kala duwan ee joogaan isbitaalka weyn ee Wajeer shacabka u adeegayaan.
And also the hospital, we have 19 specialists. Among the specialists, we have 3 surgeons, we have 3 pediatricians, we have 3 gynecologists, we have 2 urologists, we have 1 orthopedic surgeon, we have 2 urologists, we have 1 ophthalmologist, we have 1 psychiatrist, we have 1 radiologist, we have 2 physicians, we have 1 family physician, we also have 1 infectious disease specialist. And so for the renal department, we have 5 medical officers who also manning that department. We have about 12 renal nurses. We also have 2 physicians who also man that department. Currently there's no nephrologist. As you know, in the whole country we have less than 40 nephrologists, and most of them are based in the big major cities. So, but there are also plans to send some of our staff for study leave, so that they can be able to have these specialties here. Yeah. So with all those specialists, they're able to handle most of the things. We do groundbreaking surgeries. We do total hip replacements here. This is something that costs a lot, but because of the cost sharing, and this is a public hospital, any major surgery we are only charging 15,000 for the uninsured patients, but for the insured patients we are able to collect more revenue. So with the new SHA, we expect to have close to 100% insurance coverage, which means we'll have more revenue for the hospital. So we urge our people all to get insured, so that you're able to access these services.